Good afternoon. This is Bob Hauser. I'm Executive Officer of the American Philosophical Society. Welcome to this, the second of the Society's virtual public programs. I'm glad that so many of you have joined us today, and I expect that a few more are still joining. Even in this virtual environment, I want to acknowledge that the Society's home rests on the traditional lands of the Lenape people. They are still among us. We honor their community and those of other Native peoples through our collections, fellowships, research awards, and outreach activities. For those among you who are joining us for the first time, the American Philosophical Society was founded by Benjamin Franklin in 1743. Most of our nation's founders were members, and the APS had Thomas Jefferson as its president for 17 years. Like the Constitution, the presidency, the Congress, and the courts, as a source of knowledge, society was an essential piece of the bedrock on which our new nation was founded almost 250 years ago. It remains so today. The Society is a catalyst for new knowledge. Election to membership honors those who have made exceptionally significant contributions to science, the arts and humanities, and public life. The Society promotes research by providing over $1 million of research grants a year, primarily to younger scholars who need the support most. Our library and museum collections and research centers serve scholars and visitors from across the globe. The Society sustains and informs citizenry. We do that through our meetings, influencing the influencers, and other events like this one. Although our facilities are now physically closed, we remain committed to serving our mission of promoting useful knowledge through virtual programming like today's seminar. Please check our website, amphilsoc.org, both for our traditional offerings and for news of forthcoming events. With that, it's my pleasure to introduce Patrick Spiro, librarian of the Society, who will explain today's program and introduce our host.
Thank you, Bob, and welcome to the APS's virtual reading room. The room behind me is our reading room. It's usually filled with scholars making discoveries in our collections. But today, it is our virtual space to host this programming. And I'd like to thank the staff who have made today possible, especially Kyle Roberts, head of programming at the Library and Museum, Adriana Link, head of scholarly programs, and Bayard Miller, the head of technology and digital scholarship. I feel like I'm a little bit of a ghost right now. We're having technological problems, but I will keep going. I'm the ghost in the reading room. Our seminar today is going to be a discussion between Kyle Roberts and Billy Smith about the yellow fever epidemic in Philadelphia. The format is going to be a 45 to hour-long program, which Kyle and Billy are going to have a conversation for about 30 or 40 minutes. And then we're going to open up the floor to questions from the audience. The platform that we're using is Zoom, but it's Zoom's webinar platform, which is a little different from the platforms that many of us have probably become familiar with. In this system, everybody is muted, so you don't have to worry about an interruption happening. If a noise happens on your own end, we will not hear it, we will not see it. But we can welcome questions. So if you have questions on the bottom of your screen, you can see the Q&A function. Use that function to ask questions. Our moderators will receive all the questions, and we will ask as many of them as we can within our allotted time. Any questions that aren't asked, we're happy to say will be presented after the session. We're recording this seminar, and we're going to post it on our website and on our YouTube channel, so that these questions can be asked then and responded to then, so the conversation can continue long after today's virtual program. Now, before I introduced the session, I wanted to share with everybody a recent discovery that was made in our collections. Even though our building is closed, because of all the digital work we've done, many of our staff are able to continue work in the collections. And just this past week, our associate conservator, Renee Walcott, was going through the early minutes of the society. And she made a discovery that I think is particularly relevant for today's session and also for where we are today as a people. What I'm sharing with you is a minute from the 1802 APS minute book. And as you can see here, the society has confronted this problem before. I will read it if you can't see it on your screen. It says, an account of the sickness prevalent in Philadelphia, on account of the sickness prevalent in Philadelphia, no meeting was held in September nor the 1st of October. So as you can see, our history is very relevant. One of the things that's been at the core of the society's mission has been to share knowledge. In 1802, the society had to take a pause, but thanks to technology and the work of our staff, we're able to host virtual seminars like this, so the exchange of knowledge can still happen. And with that, I'm excited to introduce our program's host, Kyle Roberts. Kyle recently arrived from Loyola University, where he was associate professor of history and new media, and he was also the director of their Digital Humanities Center. Kyle's the author of an award-winning book and study on religion in New York City called Evangelical Gotham, and he's arranged to have a conversation with Billy Smith, who has written extensively about Philadelphia history and recently about its experience with the yellow fever epidemic in 1793. Kyle, do you want to take it away?
Great. Well, welcome everyone. Getting my screen set up here. We've got Billy on the line, so good afternoon. Welcome to the American Philosophical Society's virtual conversation with Dr. Billy Smith. I encourage all of you to come back to the APS website and look again. We're going to post this video afterwards. We're doing this as a way of sort of archiving the programming we're doing right now. We also feel like it's a good opportunity to share this program with people who might not be able to join us today. One thing that I'd ask you to look for if you come back and see the video again, when we first saw that manuscript that Patrick just shared, we still kind of get stumped by 18th century handwriting. So we thought it said initially because of the prevalent, not sickness, but schnapps that had appeared, the meeting was canceled, and we wondered if they were having more enjoyable times in the 1800s than we realized. But to today's subject, COVID-19 is not the first time that Philadelphia has braced for a pandemic. An outbreak of yellow fever between August and November 1793 killed over 5,000 residents of the early national city and sent tens of thousands more, including APS members George Washington and Thomas Jefferson, fleeing to the countryside. As of last night, March 31st, 2020, there were over 1,300 reported positive cases of the coronavirus in Philadelphia, and we've already experienced 14 fatalities. Most experts feel like we are just at the beginning of this outbreak. I think you'll find in our conversation today that events happening in 2020 present eerie echoes of how the city and its residents sought to cope over 200 years ago. Before we get to our conversation, let me introduce our esteemed guest, Dr. Billy G. Smith. Dr. Smith is a distinguished professor of letters and science at Montana State University. He has taught, researched, and written about early America for, and this is his words, not mine, approximately 107 years. He's published 9 books and dozens of articles. He's edited journals, and he's organized conferences throughout his career. And he's really made himself known in the field of early America for his scholarship on race and class, gender, and disease. He is a longtime friend of the APS, having held fellowships in 1982 and 1993. And Billy, I'm pretty sure you're due for another fellowship. I think we need to get you back when our library reopens. And he's also, of course, been well known in other research, Philadelphia research libraries. If you haven't read Billy's fantastic history, Ship of Death, A Voyage That Changed the Atlantic World, I strongly recommend that you go to the Yale website and download a copy for your Kindle or get a copy from when your library reopens. We're going to be posting a link in there. We've just put a link to the book in the chat box. It is a really fantastic work, and I strongly recommend you getting a copy. So without further ado, let's jump into the questions. Like Patrick said, Billy and I will talk for maybe 30, 40 minutes. We want to make sure that we leave plenty of time for the conversations that you have, for the questions that you have. So let's jump right in. So Billy, can you hear me okay?
Yes, I can. Can you hear me?
Yes, I can. Great.
Okay.
So
well,
Billy,
Pat, let me
go
say
ahead.
two things first before you actually start to ask. First, what a fabulous idea to do this. This is just a great thing to try and connect us as scholars and human beings, and I really admire it. Secondly, I'll take that fellowship offer. And as you well know, those early American founding fathers did drink heavily, so if they were into their I wouldn't have been surprised.
Excellent, thank you. So my first question is about sort of the idea for writing this story. I mean, this book, which you published in 2013, is very relevant now in 2020. Can you tell us the story as to where the idea to write the book came from?
Yes, and actually this will probably sound like it's a setup since it's the American Philosophical Society, but it actually came from a book that I perused in the American Philosophical Society maybe 15 years ago. A doctor who had lived through the Philadelphia epidemic of 1793, written about it, treated patients, Dr. Jean Devise. And so I was reading about it because I've been writing off and on about and interested in epidemics. But the thing that really jumped out at me, because I had not seen the story before, is he claimed there was a specific ship called the Hankey that had brought this disease to yellow fever by way of Africa and then the West Indies and then all the way up to Philadelphia. And then that ship had sailed on and carried that epidemic to many other parts of the North Atlantic. So I thought this was an unbelievable story, quite frankly. But I tucked it away in my memory and my notes. And when I finished some of the writing projects, I turned my attention back to it to see if it had any validity, because it just sounded too outrageous, really, to be true in lots of ways. But I then tracked this story for 4 or 5 years, from archives all the way from Paris and London to certainly lots of places in Philly, including the APS College of Physicians, Worcester, things of that sort. So I really gallivanted around the globe in a very enjoyable fashion, I must say, to track this story down. What appeals to me in this story is that it's a crisis event, and it always seems to me in crisis events is when we really see sort of the workings of society. We can understand societies better, both the good and bad parts of cultures and societies. The American Revolutionary War is such an event, of course, too, and lots of us have spent time studying that. But this epidemic also, it seems to me, opens up lots of windows into what's the nature of the society. It also fits into the kinds of themes that I'm most interested in: race, class, gender. And of course, in the early 2000s, when I first started finding this book, it fits into globalization, which was, the huge deal just emerging in the early 2000s too, because the story is one of a ship that does go from Britain to Africa to the Granadas to back to Philadelphia, and then does cause this incredible pandemic along the way.
I think one of the reasons that faculty and teachers so love teaching this book is because you really took that broad view, right? That you didn't just tell a story in one location, but you showed the sort of global interconnectedness, which we are so much more, I think, attuned to today. I'm really curious, as a historian, you pull your inspiration from lots of different places, and you just shared that you had access to lots of research collections, but I'm curious, were there any other epidemics at maybe other times in history that you looked at or thought about to think about what was happening in 1793? I mean, clearly you didn't have the current outbreak, but there have been other pandemics. Were any of those influential in your thinking?
Absolutely. I think one of the first things, well, one of the things is I was thinking, because you had raised this issue with me previously, thinking about is actually almost all my life we have had various epidemics. Now, some have been worse than others, and I would point first to the 1980s and the HIV epidemic and how startling that was, and obviously deadly to lots and lots of people. But the HIV episode also clued me into thinking about how did people, because early on when the HIV broke out, scientists did not know exactly how it was caused, how it was spread. There was lots and lots of worry about whether you could get it just like you do coronavirus today by breathing, or was it sexual contact and other things. And so it was a very interesting, although a terrifying time in terms of thinking about in the past. Yellow fever epidemic in Philadelphia, nobody knew what caused it really. And that's been true for hundreds and hundreds of years. So it's only recently in a virus like coronavirus that we actually know what's causing this. But that yellow fever epidemic, the HIV epidemic in the 1980s also became incredibly politicized, which reminded me of some of the things that were happening in Philadelphia, but politicized in the fact that the Reagan administration dismissed it primarily and early on as just a disease of gay people, and therefore almost warranted in some ways. They were that cool for a good long time. Now, fortunately, we got past that, but that certainly was stigmatized and politicized, and it certainly had an impact on my thinking about diseases. And then, of course, subsequent to that, we've had MERS and Ebola and SARS and, swine flu, just to mention a few. So, over the last 20 or 30 years, we've had lots of these things, much smaller scale than it is right now. And I think the vast majority of scholars who studied these, thought about it, realized that this is going to come back again at some point. Here it is. And frankly, it's not as bad as probably one in the future is going to be too. It seems almost impossible. We're not going to keep enduring these kinds of epidemics.
You've mentioned in there, and this kind of caught my attention, the sort of politicization of these outbreaks. And we've seen that in the past few weeks, right? That viruses know no nationality, yet the coronavirus has been labeled with one, very unfortunately in some circles. What about, is that a new invention? Is that a product of the late 20th and 21st century, or were the yellow fever epidemics at all politicized in the 1790s?
Well, first let me speak to, yes, the more recent point you were just making about, naming this as the Chinese disease. That's been used often over the last several hundred years of people accusing other countries of causing these kinds of things. That was particularly true when a certain strain of venereal disease was brought back from America, most likely by Columbus's sailors, and broke out in Southern Europe. And each nation named the other nation as being the cause of it. The French called it the Italian disease, the Spanish called it the French disease. So it's a way to slur other nations and say, well, you are the ones who are causing this. And I think that's one of the things that bothers, because there has been this long history of this. And one of the things that bothers people about naming particular societies as being responsible for it. Now, the second part of the question, in Philadelphia, the disease is incredibly politicized in the 1790s. Both the causes of it, and again, nobody knows what it is, but there's great debate on what causes it. And they split down into two camps. One is the Federalist camp, which, just as a reminder, is the political party of George Washington, Alexander Hamilton, John Adams. And the other is the Republican camp. Again, this is not the modern Republican Party, but in the 1790s, the Republican Party, which is associated with Madison and Jefferson and people like that. Well, it's the cause of that, the explanations of the virus or of the yellow fever breaks down along those two camps, but especially the treatment does. For example, Benjamin Rush, the most well-known doctor in America at the time, the most famous signer of the Declaration of Independence, incredibly admirable, works incredibly hard trying to save people in this yellow fever epidemic. He comes up with what he thinks is a miracle cure. And that miracle cure involves bleeding people a great deal. Now, bleeding is not a new thing, but he, at some point, advocates, mistakenly, to bleed people of more blood than they have in their body. And that doesn't seem to really help people too much, obviously, in this kind of situation. But this becomes known as the Republican cure. On the other hand, there is the Federalist cure, which when Hamilton, a Federalist, catches the disease in Philadelphia, he takes the Federalist cure. He refuses the Republican cure. Now, he's lucky because the Federalist cure is believing doctors like John DeVise, who've come out of the West Indies, who've seen yellow fever before, who know you don't need heroic measures to try and save people. You just need to nurse them, give them a lot of water and fluids. Actually, since he's French, he says drink a lot of French wine, and make certain that they're nursed on a regular basis, and probably they will survive that. So Hamilton does exactly that. He does survive it, but again, there is this huge debate in newspapers and everywhere else about what cure should we take and with what political party is it associated.
Wow, that's fascinating. You're starting to touch on their questions of knowledge, right? Questions of knowing, and the sort of West Indian doctors and the sort of emigres from Saint-Domingue that you talk about in the book have a knowledge that it seems many other Philadelphians don't have. And I think about today, right? And thanks to modern communication media, we've been able to trace the spread of the coronavirus over the last few months, right? We've initially saw the outbreak at the end of December into January in the Wuhan province, and it's been coming our way. Did 18th century Philadelphians have any idea that yellow fever was coming? Was there, how did they, how did that maybe throw them off, or did they actually know more than I am guessing they did?
Excuse me. Well, today I think this is pretty unusual, the situation we're in, because it's been this kind of slow development across the world, right? I mean, we've known about this since late December, basically. Most of us who were taking this disease seriously knew it was coming, so we had 2 or 3 months to prepare for it. But it is a tragedy that's unfolding slowly, whereas I think most epidemics in the past, especially localized epidemics in a place like Philadelphia, it just happens all of a sudden. And within 2 weeks, you're in a real crisis situation. So Philadelphians did not know this disease was coming. However, when the Hankey left Philadelphia, it had already gained a reputation for spreading yellow fever. It had done that in Grenada, the West Indies. And this reputation had gotten back to Britain already. The Privy Council actually puts out an order to sink the Hankey, to sink this ship. So they knew this was coming. Once it got to London, actually, they did exactly that. They sank the ship, they burned it to the waterline. At the same time, though, other ships were coming out of Philadelphia carrying yellow fever to places like Spain and Italy and southern France, as far as Egypt. And those places did eventually know this was coming. And the way in which they reacted was to shut off all trade with America in some cases, all trade with Philadelphia specifically in others. So there were some instances at the time where they knew this was coming. Philadelphia 1793, no, they didn't really.
And if I'm remembering correctly, 1793 was not the first time yellow fever had arrived in Philadelphia, right? It had arrived earlier in the 18th century, but maybe people had forgotten about it or had thought it was no longer a possibility, or?
It had been, there had been a yellow fever outbreak in 1762. There had been some before that in the earlier 18th century too, but it had been 30 years or so. Okay. And so in lots of ways, I think it was out of people's minds that this was a possibility. What it also meant, though, is because it had been 30 years, is that virtually nobody in Philadelphia in 1793 had caught the disease in 1762. Once you catch yellow fever, you're immune. If you survive it, obviously. So they are really vulnerable to this disease that nobody really has seen. Nobody knows how to treat, really, because, again, the doctors from 30 years earlier are not around anymore. And you're precisely right, though, and you're also saying that, you know, the West Indian doctors who are coming here, most of them fleeing the Saint-Domingue Revolution, are bringing knowledge of how to treat yellow fever because it is endemic in some areas there.
So if you've been in a supermarket or a convenience store in the last few weeks, you have probably, like me, seen duct tape on the floor telling me what 6 feet is from the person in front of me. I think we've gotten a crash course in social distancing. Was there an 18th century equivalent of social distancing?
Absolutely, and mostly it was just out of fear, and that people would talk about during the yellow fever epidemic. It was much like we are right now. People shut up in their houses, and people afraid to go out on the streets. Again, because you have no idea what is causing this epidemic, whether it's catching or not. They don't know it's mosquitoes that are causing this. People won't know for another 100 years whether it's what causes it. So they are very afraid of one another. They talk a lot about talking across the street from one another. Now, these are narrower streets, but it's at least 6 or 8 feet across, so it's probably very close to what it is today. Handshaking goes out. And this had always been a popular thing among Quakers in Philadelphia because it was kind of a sign of equality. Rather than tipping your hat, you shake somebody's hand and look them in the eye. And this was sort of reinvigorated during the American Revolutionary era too. But of course, you don't touch anybody if you can keep from it, because again, you have no idea how this is being passed along to each other. And the streets are essentially deserted. You know, you look at the pictures now of New York City or San Francisco and things, and it's just startling. Well, this is what Philadelphia is looking like for about 3 months there. People talk about grass growing in the streets after a couple of months because there is absolutely no foot traffic. Now, having said all of that, people still need to go out to get food, just like they do today. And that becomes a real crisis for Philadelphia. Farmers won't bring in food. Understandably, they don't know how to keep themselves safe from the disease, and ship captains won't land ships, so they really run low on food, and a lot of people really suffer from hunger during this time.
That's makes me think of another question I had wanted to ask about sort of the economic impact of epidemics like yellow fever or like COVID-19. I think many of us have experienced personally or seen close friends and family lose their jobs in a seemingly very short period of time because of the measures that we've undertaken nationally. Did the yellow fever outbreak have a similar effect on the economy? You kind of alluded here to the inability to sort of get fresh food, but was there a larger sort of ramification, and do you have a sense of how long the recovery was from that?
Well, the city, after about 4 weeks of yellow fever, people panic, and many people leave the city if they're in sort of financial shape to do that. What it means is maybe a third of the people leave the city to go outside the countryside, find very expensive housing to quarter. So they have to be pretty wealthy to be able to do that. So the half or 2/3 of the people who remain in the city mostly are poorer people who are there, who really are suffering because everything closes down. Ships won't come in anymore, won't dock there. Again, farmers won't come in. So, and all the businesses closed down essentially. So in many ways, it is like what we're seeing happening in our own environment now, with businesses struggling with this, economic malaise, and nobody quite knowing what to do about this. When yellow fever ends, and the reason it ends, although they don't know it, is because the frost begins in early November, kills the mosquitoes. Well, it takes a week or 10 days before people are sanguine enough to actually come back to the city, to go back out and open their shops up and things like that. Relatively quickly, though, they're able to get back on their feet. But it's because there's a quick end to the virus, too. And that's the yellow fever, which is somewhat different from what it looks like coronavirus is now.
Yeah, agreed. So there's an image right now up on the screen of Thomas Jefferson. And think one of the things that your book so nicely reminds us is that in 1793, Philadelphia is the largest city in the United States. It is the capital of Pennsylvania, right? So the move to Harrisburg doesn't happen until 1812. And it's also the capital of the United States. So that's a lot of political leaders in one place. But if I'm reading your book right, the elected leadership doesn't come off very well. In the end, and correct me if I'm wrong, I think it's only Mayor Matthew Clarkson who doesn't flee the city in the midst of all of this. What do you think we have to learn about political leadership in terms of crisis from this historic moment?
Well, I guess the cynical perspective would be they're just all cowards. But I don't want to go exactly there, and I don't think that's precisely true either. But it is the case, and I'll just add a little bit more to what you're saying here, that the government falls apart. And it's the federal government, the state government, and the city government that are there. And almost every official, as you just noted, leaves the city and abandons their post and their responsibility to the community. And so the mayor really is the only one that's left. The positive side of that, perhaps, is that what happens in Philadelphia is that people step forward, ordinary people, coopers, carpenters, African Americans, slaves, free Black people, step forward to save the city. And I think that's one of the positive stories of this, is that even if the government has disappeared and the officials have disappeared, it's the people themselves who are able to organize relief efforts and to able to help one another out. The African American community here is one that is particularly steps to the fore. Most African Americans in Philadelphia at this point are free. There are still some slaves, but it's being phased out. And most of those African Americans had either run away from slavery or fought during the Revolution and gained their freedom, or been able to purchase their freedom. So we have a number of African Americans, maybe 5,000 or so by 1793, who've made it to Philadelphia, making this their new home, constructing a community there, building churches, building schools, things of that sort. When the epidemic breaks out, the leaders of the African American community, Richard Allen and Absalom Jones, two preachers, step forward and offer the services of African Americans. Now, they've been told that African Americans will not catch yellow fever. They're a little bit skeptical of that, and they were right to be skeptical. But on the other hand, they are willing to risk their lives stepping forward to help out the vast majority of people who are there, to do lots of the work that, frankly, white people are too afraid to do. Go into sick people's houses, bring them water, which again, just being hydrated is one of the ways you can survive yellow fever. Nurse them. They talk a lot about picking up orphans on the street who just have no idea what's going on, that their parents are dead. There's lots and lots of just terrifying stories here that I think we can understand a lot better, unfortunately, nowadays. I can feel that terror around the society that they're talking about then. But that they step forward and actually become the guardians of the city in lots of ways. Now, there are also white Quakers in particular who are committed to their community, who organize the overseers of the poor, help with assistance and especially foodstuffs and things of that sort. So I think what we see here, and again, why I like this story in lots of ways, is how ordinary people step forward, organize, and whether or not there's official institutions, get things done and are able to help each other out and are able to save their community.
That's wonderful. Do you think, does your research show that people appreciated and recognized the contributions made by African Americans and other ordinary folk, or is that something that's fallen out of the story subsequently?
Both, I guess. Both. There is a lot of recognition, and the mayor himself writes commendations to the African American community after things have settled down. And there's lots of other people who are praising the African American community. However, racism is running deeply in American society, of course, in a society that has slavery, even if Pennsylvania is phasing it out. There are a number of prominent people who are critiquing the African American community. In particular, a man named Matthew Carey, who's a publisher and a writer. He writes one of the first instant histories, I guess, in history, and that is within a couple of months, he writes a history of the 1793 epidemic. In that history, he criticizes some African Americans for asking for too much money, he claims, to tend people, to help people, to bring them water, to nurse them, and things like that. Now, it's not an uncommon thing all the way back to the plague. You find lots of these people complaining about nurses and things of that sort who maybe charge too much, at least according to their opinion. But what this is it's overridden with racism, of course, in a way that, you know, in Europe in the medieval ages and the plague years didn't have that same kind of component. So unfortunately, there's a downside to that as well.
So at the APS, we've been talking a lot about what materials we might be collecting related to the COVID-19 outbreak. I think many people know the APS as a library of early American material, but we also are very active collectors on the history of science and on 21st century topics. So it really is in our mission to be collecting materials. As a historian of the yellow fever outbreak, I'm curious if you might give us a little guidance. What sources do you wish that people had collected in the 1790s that you could have used in writing this book, but that they didn't?
Well, I would have loved many more firsthand accounts, both from doctors, but also just ordinary people. And there are a few from Quakers who keep journals and diaries and things of that sort. There is this Dr. Jean Devise who lives through it, and his book has ended up in your collection too. Things of that sort, it seems to me, that gives us the feel of daily life as it's happening too. And that seems to me that might be some of the most valuable materials that one might collect. I also think, now this is just an aside too, but I'm kind of interested in some of the humorous responses to this, the dark humor responses. In Philadelphia, they have dark humor too at the time as well. But, are there ways to think about, it's not just the horror and the terror of the epidemic, but also the heroes, the humanity, the way in which people are able to cope, even if it is through kind of cutting humor, things of that sort. I don't know if that's possible to connect those or to collect those kinds of things, or if that would fit in your collection. No, actually either.
Well, we can certainly try. We're right now, give a plug, we're hiring a digital archivist. So for anybody out there who is a digital archivist or who knows one, please encourage them to apply. It's a hugely important part of collecting the 21st century.
Yeah.
We're looking to get the best person we can in that position. Before we switch over to, we already have a couple questions lined up. Let me just ask one final one. And it's me wanting to end on a positive note, if possible. What did hope look like for 18th century Philadelphians? How do we have any evidence of how they coped with uncertainty and tried to stay positive about a future that they really didn't know what held for them? Is there something we can learn from them, you feel?
That's a hard question because I tend to see more despair than the hopeful quality of the people who are there. But they do write poetry. There are a number of novels that are written at the time, talking about both the epidemic, but also the possibilities of the future. And it is also the case that Philadelphia, especially in the 18th century, has been a place traditionally of the Enlightenment, of people who really do believe, or at least some of the, in the future, the possibilities, especially of a new nation, of improving the human condition, things of that sort. I guess perhaps the other place I would go to is the sense of personal responsibility to the community, again, is what I think is the most positive thing that I can take away from it. Not just the African-American community, but the Quaker community, the people who step forward to help their friends and their community and are committed to that and are committed to the future survival of Philadelphia and flourishing. And of course, as we know, historically, that's exactly what does happen eventually, even though it does take a while.
That's great. I think that's wonderful. So for the 150 or so folks who have been following along today, get out your laptops and your pencils and, do some journaling, write some poetry, archive your social media pieces, and I think we've seen some really wonderful examples of personal responsibility that people have been taking. Be kind, be human, be safe, be smart, but think about those who are in need and think about how you can help them. So let's switch over to the question and answer period now. Adrian, if I could ask you maybe to take down Billy's slides, and I'll see if I can. So if, as everyone at home looks at the Q&A, looks at their navigation bar at the bottom of Zoom, right in the center, there's a box that says Q&A. We want to archive all of these questions. So if I can ask people to go ahead and just enter your questions there. And let's see, what's the first one that we have here. So this is from David Maxey. Did the well-off invariably achieve protection in fleeing the city? And second, what accounts for the diminution of yellow fever in Philadelphia after 1798, at least in my impression? So the first question, and I think you started to get to this, Billy, about the sort of inequality of opportunity for different classes as they face this outbreak. And then the second one, does yellow fever really go away after 1798?
Yes, the wealthy make it out a lot better. Surprise, surprise, which we see in our own times right now too. I mean, class does define people's lives in lots of ways. But if you can get out of the city without having contracted the disease, then you probably are going to be okay. In fact, even if you live on the western part of the city, I've been able to map along with, and I want to put in a plug for my person I've worked with a long time on mapping. I'm sorry, I'm having a senior moment right now. But in any case, we've been able to map a yellow fever epidemic. And the great majority of deaths are right along the waterfront. Now, Philadelphia at this time is a waterfront city along the Delaware River. And if you can get away from the waterfront, such that you can get 5 miles inland, mosquitoes don't go that far. So you're not going to get yellow fever. So if you have the ability, and that's usually financial, to get out of the city, yes, you're going to do much better. And probably 2/3 of the people who die from yellow fever are of the middling or poorer classes. In terms of when does yellow fever end? Well, actually, for the next dozen years, yellow fever not just strikes Philadelphia repeatedly, not every year, but maybe every couple of years, but also every major American city, Boston, New York, Charleston, New Orleans, all get attacked by yellow fever. That dies down somewhat with the beginning of the War of 1812, well, first the embargo of 1808 and then the War of 1812. So yellow fever epidemics die down in part because there's just not as much traffic going back and forth across the northern Atlantic, but also because the slave trade is cut off, both by Britain and by America in 1808. So that's part of that. Now, yellow fever comes back again at various times, I think it's 18, 19, and 20. But when container ships finally come in, that's one of the things, because it's the water casks where these infected mosquitoes can hitch a ride on a ship. Once you start covering those up, then it really cuts down on yellow fever moving around the world too. Just one more thing, yellow fever still is present in lots of areas today, especially Africa, and it kills about 300,000 people a year. So it has not stopped by any means.
That's a really important point. I'm glad you made that. I think that's important for us to keep in mind. Colin Purrington has a question here. Did any groups or neighborhoods during that time try to minimize the mosquito population? Do we have any example of sort of them maybe inadvertently decreasing yellow fever risk by, dumping out stagnant water? Or, was there any sort of maybe public health initiatives that didn't intend to do it, but sort of ended up minimizing the outbreak?
Not that I'm aware of. I mean, I did see, actually, there is one very curious piece in one of the newspapers in which one of the contributors is just talking about how many more mosquitoes there had been in 1793. The weather patterns were such, mosquitoes were really proliferating. And he said, look, if you just put a little bit of oil in your water cask out behind your house, that will keep the mosquitoes down, which he was exactly right. That would have done it. Now, nobody had any idea that if you could limit the mosquitoes, that therefore you would be fighting the disease. So, no, the efforts were to clean the streets, to get things like coffee, I know, that had been dumped in various places on the wharves, but no effort really to cut into the mosquito population. People live with mosquitoes forever, and so they weren't really expecting this was the cause.
Great. So we've got a whole Stephen Gerrard contingent here. I count about 5 questions, which I'll sort of lump together. So can you talk a little bit about Stephen Gerrard and fighting the epidemic? What place did he have in this? We know that he was America's richest person, a hugely successful shipping magnate at this time. Where does he fit into your story, and what do you sort of think of his efforts?
He's a hero, and I probably should have mentioned him in connection with the people who, are fighting the epidemic, and lots of heroines, by the way, and I've ignored some of their names, unfortunately. But he certainly steps forward and helps organize caring for patients. He, as my memory serves correctly, comes out of the West Indies, so he knows yellow fever, and he's had yellow fever before, so he's pretty sure he's immune. And he realizes also the kind of things like Benjamin Rusher saying about the treatments are just ridiculous. It's going to kill more people than it's going to really help. Mm-hmm. So much to his credit, he is one of those who steps forward, goes out into the streets, literally, and he's not absolutely sure that he's safe, although pretty sure of it, but really does help organize, contributes money, and helps organize the hospital, in particular, the Bush Hill Hospital as well.
And I think thinking about Bush Hill and your description of it in the book makes me think about the sort of pop-up hospitals that we're seeing appearing now.
Yes.
Was that an innovation at all, or was that a sort of typical response in times of epidemic to sort of commandeer property and turn it into other uses?
Well, it was very difficult for them. They had to argue among themselves for a little bit more, longer than they probably should have, for a week before they took over this Bush Hill, because they were saying this is private property, we can't do it, we can't do it, we can't do it. But they did finally say, well, we're desperate enough that we'll even go against this and take over this private property. As far as I know, in earlier epidemics, maybe I should hesitate to answer that, because I'm not positive. Now, there is a hospital, of course, in Philadelphia, founded by Benjamin Franklin, been there for a while. They do set up tent cities in future epidemics outside of the city, and that also is reminiscent of what it looks like in New York City right now, too. Whether they had done this kind of thing in smallpox epidemics in the 60s and 50s and 40s, I really haven't thought about, or I don't really know.
Okay. Excuse me, I'm seeing a question here from historian Paul Sivitz, who I think we both know. He's asked...
Oh! I'm sorry, that's exactly who I was trying to think of. Thank you, Paul, very much. I'm sorry, I had my senior moment. He and I have worked on mapping Philadelphia, and I'm glad to be able to acknowledge him.
So, Paul...
And I hope he answers and asks an easy question.
We'll see. So his question is, can you talk about Dock Creek as ground zero for yellow fever?
Oh, indeed. That is one of the things, as Paul well knows, in our mapping. That up and down the Delaware River is the highest concentration of yellow fever deaths, and Dock Creek, because Dock Creek at this point, it's not really a creek, it's just a sludge pool. People are throwing everything into it, they're urinating into it, there's even accounts of dead animals floating in it, things of that sort. And of course, it's the center of yellow fever mosquitoes too. And so anybody who lives near Dock Creek has a really good chance of catching yellow fever.
And I do want to give a shout out to you for the fantastic mapping that you have done. I don't think anybody, I think we'd be hard pressed to find many scholars other than you and your team who know as much about Philadelphia on the ground in the 1790s. And I particularly like, I think it's, is it chapter 8 in the book where you literally walk us through Philadelphia because you've been able to do that level of reconstruction. Is that, as you look back on that great DH project, is that one that you would do again? Are there any sort of lessons learned for future scholars of epidemics in taking that really ground level view?
Well, I would absolutely do it again, partly because of the people I worked with. And once again, Paul is one of those. But also the team of GIS people that we had, both a professor and also graduate students, and we were able to get some of our own history graduate students. It took us 3 summers maybe to put all of this together. I mean, this was concentrated work for maybe 3 different summers, so it took a lot longer than I would have anticipated. I knew the records extraordinarily well. I had a head start and these kinds of things. It still took much more effort than I would have anticipated. On the other hand, working with other people is great. And one of the reasons I've tried to co-author things and things of that sort is because then the academic profession and scholarship don't get so isolating. And so I wouldn't have given up that kind of teamwork for anything. And I am so pleased with the results. One of which is a map of the first free African-American community in America. And to Paul and my great pride, it's in the new Smithsonian Museum of African-American History and Culture. And we are just really proud of that.
That's great. If for all of our followers at home, if you haven't been to the new museum at the Smithsonian, you absolutely have to go. And I want to thank you, Billy, for your generosity. I believe I'm correct that you have shared the data that you have found and that people can download it on the Magazine of Early American Datasets. Is that correct?
Yeah, I don't know if it's on that magazine, but we will make that available very soon. Paul and I do have a website, and that's where they can go to both for the maps, for the data, and things of that.
Excellent. Well, we'll make sure we tweet that out afterwards and put it on Facebook as well so people can find it.
All right.
Maybe a few more questions. Elizabeth Root asks, was Rush the only doctor who was using bleeding as a means of treatment at this time, or did he have sort of a coterie of followers?
He had some followers and sort of student of his who were also doing it and carrying out his bleeding. And it was a real argument between the College of Physicians and then Rush, who had been a prominent member of the College of Physicians, but who broke with them. And so the majority of doctors, I believe, although it's hard to tell because they didn't keep good records, but the majority of doctors probably were not following Rush. However, Rush and his coterie were extremely, to his credit, Rush says he saw 100 patients a day on average. And so that's a lot of people. And if you, prescribe that kind of bleeding, it really is going to end up disastrously in most cases. Rush himself, so by the way, just one more word on him. He's pretty egotistical. He believes in his ways. He doesn't keep any records, but he keeps saying, oh yeah, this helps, this helps, this helps. But that's not too unusual for the time. Doctors still aren't keeping enormous records of, how they're treating people, whether those people get well or not, or things of that sort.
I'd like to give a shout out to the library company, which has many of Rush's manuscripts in its collection. They've recently digitized, I think, almost all of his medical manuscripts, and those will be available for public downloading very soon. To learn more about Rush, who is indeed a fascinating figure. You'll have this access to manuscripts that has been limited really largely to scholars who've been able to come in up to this point.
Yeah, that's great to hear, actually, because I worked on his papers there in the HSP years ago.
And you're a little distant from Philadelphia these days. So.
A little bit right now, yeah.
Great question here from Naomi Gonzalez asking, what role or roles did women play during the yellow fever epidemic?
And thank you for asking that question, because there's several different things. One of the women I wanted to talk about was a woman named Anne Seville. She's an African-American. She's also prominent in the African-American community. And what she's credited with is organizing Bush Hill Hospital and turning it from a place where people just go to die to a place where people go who have a good chance to succeed. And once again, she's able to, and also to recognize Stephen Gerrard once again for financing some of this, able to get together, blankets, places to sleep, ways to get water to people, ways to just tend people who are laying on the floor often, and things of that sort. But she's credited, especially by Jean Devise, Dr. Jean Devise, as being the one who organizes this hospital and is able to save hundreds and hundreds of people rather than having them just expiring on the floor itself. In other instances, I think one of the things that lots of women, middle-class women, and even upper-class white women are facing at this point is whether or not they're going to stay in the city. And it's very difficult to piece out exactly how all of them are making this decision. And some of these letters that I've been able to read, their husbands make their decisions for them often. But there are some women, and I think Elizabeth Powell is one of them, who make their own decision whether they're going to stay there or not. So I think in those ways, they are torn between they want to be with their family, clearly, they're committed to their community, helping them out, but are they the ones who actually, frankly, the way in which the society is set up, should they be making that decision? Should their husband be? Should they differ with their husband? Things of that sort. So I think that's a real conundrum for a lot of these women.
And that leads actually into a question that Molly Neoblow, who is one of our Digital Humanities Fellows at the APS and who will be with us this summer, asks about if there's any sort of counter argument about not spreading the disease by keeping people in the city, right? Is there any historic record that shows that doctors or officials or anyone else questioned if people fleeing elsewhere could possibly send the disease with them?
And the answer is yes, indeed. There are a number of people who are saying don't leave the city because, especially early on, when they think a lot of people think it's caught from somebody else. And so if you leave and go out into the countryside, then you may be spreading that. In the countryside itself, people start to respond against that too. I think we've seen that somewhat right now, right? Florida, I think, was saying, New Yorkers don't come down here. Mm-hmm. Montana, where I live, there's been a huge influx of people into Montana, this kind of, understandable panic trying to get out of what looks like a worse situation. But lots of other places start to close their doors. New York City, after a while, won't take in anybody from Philadelphia, and other sort of cities start to do that as well. Even Hamilton, after he catches the disease, stays in the city for a while, decides to leave the city, and he stopped in upstate New York and even jailed and quarantined for a short period of time because people are very afraid that people flying away from Philadelphia are going to spread the disease.
So I think we've hit the 2 o'clock hour. I want to, as a way of wrapping up, encourage people once again to go and get a copy of Ship of Death. It is, as I've said, a fantastic read. It is so pertinent to what we're dealing with today. And, most of us are inside, so we have lots more time to read. I want to encourage people to keep an eye out for those rush papers at the library company when they become available. I want to give a shout out to the Gerrard College history collections, which includes Stephen Gerrard's papers, the admission and burial books for Bush Hill, so find those materials. Please come to the APS website and look on our social media for more hints. Are there any other books by other historians, Billy, that you'd like to plug for our reading, either about epidemics or just good reads that could distract us in these days?
Well, you caught me off guard there. I got the only book that's worth reading. That's really a lie. Sorry, just nothing's coming to mind right now.
Sorry for putting you on the spot. So Well, thank you everyone for joining us today. We do have another event coming up next week. Adriana, do we have the slide for that? This is Paul Miles, who's going to be talking on Tuesday about Tom Paine and the rise of Tom Paine and the cases of the officers, the excise. Many thanks, Billy. And please stay safe. And I look forward to talking to you again soon.
You too. Thank you very much, Kyle.